Hormone therapy is used to treat menopause-related conditions and symptoms. In this article, we explore differences in the duodenal microbiome of women of reproductive age, women on hormone therapy, and women not taking hormone therapy. We also look for potential associations of hormone therapy with metabolic markers. We examined the following 3 groups of women from the Reimagine study. We observe that the HT plus group and the RA group had similar testosterone levels. The HT minus group had significantly lower levels of testosterone than the RA group. The HT plus and RA groups also had similar levels of fasting glucose. The fasting glucose level in the HT minus group was significantly elevated. We also saw significantly higher microbial diversity in the HT plus and RA groups compared to the HT minus group. In all 3 groups, we see associations between diversity of the duodenal microbiome and fasting glucose. We also see associations between diversity of the duodenal microbiome and testosterone levels. As duodenal microbial diversity decreases, glucose levels increase. As duodenal microbial diversity decreases, testosterone levels decrease. Further, we see that the core duodenal microbiome of HT plus women was more similar to that of RA women than HT minus women. At the phylum level, the prevalence of proteobacteria in the HT plus and RA groups is lower than in the HT minus group. At the phylum level, the prevalence of Bacteroidetes is higher in the HT plus and RA groups than in the HT minus group. We also observe in postmenopausal women that the relative abundance of Bacteroidetes is associated with both fasting glucose levels and testosterone levels. A higher relative abundance of phylum Bacteroidetes in postmenopausal women is associated with higher microbial diversity, lower fasting glucose levels, and higher testosterone levels. Within phylum Bacteroidetes, one of the most important taxa which contributed to these associations was the genus Prevotella. The relative abundance of Prevotella in the duodenal microbiome in the HT plus and RA groups was higher compared to the HT minus group. Lower relative abundance of the genus Prevotella is associated with an increased risk for cardiovascular disease. Therefore, we also looked at the relative abundance of other microbes associated with cardiovascular disease risk in the duodenal microbiomes of the HT plus and HT minus groups. We find that the HT plus group had a lower relative abundance of Escherichia, Klebsiella, and Lactobacillus genera. These genera are associated with increased risks for cardiovascular disease. Our findings show that the HT plus group had higher microbiome diversity than the HT minus group. The HT plus group had higher testosterone than the HT minus group, had lower fasting glucose than the HT minus group, and had higher relative abundance of Prevotella than the HT minus group. And the HT plus group had lower relative abundances of Escherichia, Klebsiella, and Lactobacillus than the HT minus group. These changes are consistent with a potential beneficial effect of hormone therapy in postmenopausal women.